Now I'm going to move forward with our program. I want to introduce Senator Valerie Lawson, who is leading this initiative on the Senate side. As you all know, she's a teacher and has dedicated her life to educating children in our state, and what better person to sponsor this important legislation? Senator Lawson.
Thank you, Amy, and thank you all today for being here. I'm honored to sponsor this bill because I know our constituents and their families need help now more than ever. I'd especially like to thank all of my colleagues who have co-sponsored this legislation, and especially recognize one of them, my colleague, Senator Ilana DiMario, for being here today. And I'd also like to thank all of the advocates and coalition members who have worked diligently to support this bill and inform our constituents about its significance. The pandemic has shined a glaring light on food insecurity in our state. Recently, the Rhode Island Kids Council released their annual fact book showing that the pandemic had a disproportionate effect on our children, particularly those of color. According to the Rhode Island Food Bank, 1 in 4 Rhode Islanders go hungry, one of the highest rates in the nation. Particularly our most vulnerable constituents, seniors, communities of color, low-income populations, and our children. It is with this in mind that I've sponsored this extremely important legislation and why it is my priority, and I hope it will be that of the General Assembly. And today we are here to bring this important bill to a vote during this session. As proposed, S-327 would establish a retail SNAP incentive program in retail settings across Rhode Island, in grocery stores, and other places where fruits and vegetables are sold and EBT is accepted. The SNAP incentive program would provide a 50% match discount on fresh fruits and vegetables for SNAP recipients across Rhode Island. It expands the purchasing power of healthy foods for our constituents who need it the most. Passage of this legislation would impact health of over 140,000 Rhode Islanders who receive SNAP, and 47,000 children, and over 30,000 senior citizens. Those numbers are significant, and every one of our districts would be impacted in a meaningful way. The program would tax 1.5 cents per ounce on unhealthy sugary drinks. Data has demonstrated sugary drinks are the leading contributors to things like diabetes, heart disease, and obesity. And when these taxes are implemented, consumption of these beverages go down. It's a true win-win for public health in Rhode Island. Many of my colleagues have approached me and agreed, and I believe there's never been a more important time for this legislation. It's truly good public health policy for our state. Passage of it would increase the amount of healthy food we can provide to our most vulnerable constituents, while decreasing the consumption of unhealthy items that pose a disproportionate burden to our constituents. Again, I'd like to thank you all for being here today. There's never been a more important time for this legislation, and I look forward to working with all of you during this week of action. Thank you.